Yeah, hi, this is Dr. Adityan Guhan, Director and Founder Aegis Healthcare. As you rightly asked, the technology has taken us a long way in terms of imaging, in terms of diagnosis, and also in terms of patient communication. For example, in olden days, patient had to visit the hospital for a diagnosis or a treatment. But now, in case of any guarded circumstances, if the patient is not able to make it in person, we can still see her like an ultrasound, or we can see her MRI. We can still treat her through a video call or any other platforms like Skype. So definitely technology has come a long way in medicine, especially in COVID. It helped us a lot. Basically, I'm from a family of doctors, a third generation. My dad and mom both are doctors. My mom is a family physician. Dad is an oncologist, and he's kind of a workaholic. He has not taken a single day off in the past 20 years. So I've grown up seeing him, and I really like serving people, especially uh, curing the pain. Curing the pain and giving them a better quality of life is what I really like about healthcare. And I had an opportunity to be a part-time physician in Marcel checkup in PHG hospitals, where I did my MBBS and MD. So I had a calling towards preventive healthcare from PHG. So when I was there for past for the 2 to 3 years, I had an opportunity of detecting very young hypertension, very young diabetes, and cancers, etc., which really made a significant change in their not only the patient's life but also the entire family in terms of financial and emotional burden. So I thought preventive healthcare is one area where a lot of emphasis is not done in India. In Western countries, due to insurance, everyone does a muscle checkup every year to renew the insurance. But here, only when they have some pain or only when they have some disease, they go to the hospital. So I just want to break that mindset, and I want to focus light more on preventive healthcare. So I started my own standalone muscle checkup center in 4 years back in Cyberpark Colony, and I just analyzed what makes people not do a muscle checkup here. Then it was time consuming, and it was like if you go to a higher setup, you have to wait for a day and all. So we modified the protocol. We brought in half a day muscle checkup, wherein we pick up the blood from the patient's home in fasting, and it takes 4 to 5 hours for the blood workup to be done. If the patient comes to our center at the fifth hour, we just spend 1 hour there. They do all the imagings, meet me, and they go back home. We have to, actually speaking, we have a long way to go. We are trying to simplify, to reach more people and to make them understand the importance of preventive health care, because nowadays, because of the lifestyle, eating habits, pollution, etc., we see a lot of hypertension and diabetes. At least diabetes, we have few warning signs like hunger and muscle loss and stuff, infections. But hypertension is one area which goes undiagnosed totally. When you have a hypertension variability, you at the end stage, you either have a vision loss or you have like kidney disease. Only then people know that they have been having hypertension for so many years. So I think people should understand the hazards of evolving lifestyle, and they should themselves come forward to do a muscle checkup. I don't promote for myself. It's not that they should do with me. They should just undergo a muscle checkup every year once. Most of them ask me whether there's an age criteria. Initially, we used to say after 50 years, But now, due to post COVID, young strokes, heart attacks, I would urge people from 35 years to undergo a mast cell checkup yearly once. And if there is any family history of diabetes or heart disease, then from 30 itself is advisable. I think as you asked, you have to, Coimbatore has to understand the importance of preventive healthcare more. I wanted to do a mobile cardio diabetic screening, which we are only seeing the tip of the iceberg as we all focus in the city, and I want to go inside smaller villages in a weekly base camp and offer them like HbA1c is a gold standard of diabetes and hypertension. For screening hypertension, ECG is there. So I want to do ECG and HbA1c through a mobile van and to reach the bottom of the iceberg. In the short term of 4 years, starting my preventive healthcare center, there is around 485 patients roughly I have seen, and we have detected very rare diseases like very rare cancers, very rare phenomenons, and we have really been able to save their lives and bring in a lot of change in the quality of life. And we also started a first online pharmacy in Coimbatore, which we give 50% offer for all the. First, we were giving for senior citizens. Now, after COVID, we are giving for all. So, a lot of people utilize that. If they upload a valid prescription, we deliver the drug mostly on the same day. So, I think both Muscle Checkup Center and online pharmacy, I'm really not proud, happy that I have been able to establish it. My vision was to establish first in Coimbatore and to do a satellite centers in smaller towns. Probably a physician cannot go there or cannot sit there, but we can still do the setup there. And as you asked, you know the technology is developed, so I need not go and see the patient in live. Maybe they can do all the tests, and with the reports, I can consult them over a video call. So definitely, there's a plan of expanding to smaller towns. See, Coimbatore people are very price sensitive. That's what I want to tell. So they do understand. Certain people do understand the importance of health checkup, but they also think that it is very expensive or it is not necessary when we are healthy. So maybe at that point, I want to tell, if I have to offer a quality health care, then I have to pay for my everything like the machines and staff and facilities. So people should understand that it is not for the profitability of the doctors. We have a very thin profit where if you in terms of preventive health care. So I think people have to understand that is what I feel. I wanted always 24 hours BP monitoring on any of a device, probably on a as Apple Watch monitors your heart rate. If there is any arrhythmia, if there is any heart rate or heart like any sinus bradycardia, we call it as bradycardia is slower heart rate, tachycardia is faster heart rate. So both it warns and it saves life. As I said, BP is one of the very silent killers in recent times. So maybe a 24 hours BP monitoring. Now there is BP monitor 24 hours BP monitoring there, but it should go. You should go to a physician. You should wear that tags and all. So maybe probably easier method to monitor 24 hours would be good. We had a quiet post-COVID complications because I was doing a COVID time. We were doing a home quarantine services. We did cure 2,200 patients in second wave. They didn't have beds, so we had an action team. We created ICUs at home. We in fact we used Rapido and all to transport oxygen concentrators to Salem along with the staff nurse. So post COVID, we saw quite a few vascular complications. For example, a patient had a severe hip pain and he was having it continuously for a year. When we did the MRI, he was very young, he was 30 years old. Still, he had both bilateral avascular necrosis of the femur head, which means our pelvis, we have two femurs for the legs to balance. The head of the femur sits in the pelvis, hip bone. So the head of the femur had a vessel block and he had avascular necrosis. So it was very kind of rare. And after that, when I started researching, there was a lot of young people post COVID having the same sort of issues. It's like a heart attack or a stroke. If the blood vessel blocks in your heart or brain, it will cause heart attack or stroke. The blood vessel has been blocked in his bones. So part of his 50% of his bone was dead. So it was a very interesting case. Maybe Harvey, he's the man who has taught us about circulation. So maybe I'll ask him how to keep our arteries patent.